necessarily those of KKNW, its management, or other advertisers. This program is sponsored by Dr. Pat Basili and Transformation Talk Radio.
Hi, welcome. This is Dr. John DeMartini. This is one of the most amazing and inspiring shows that you can listen into. If you want to be on the edge of your seats, if you want to open up your heart, if you want to expand your mind, and you want to meet incredible people, stay tuned because you're just about to experience a transformative radio show that will change your life. And you're listening to the Dr. Pat Show that's coming up right next.
Welcome to the Dr. Pat Show. Talk radio to thrive by. Powerful, inspiring, and coming to you live, bringing you stories of people like you and me, busting through and living life full out. Get ready to dare to wonder what your life would be like if you knew you could not fail. Hey, everybody, welcome. Welcome to the show. I want to just say to everybody right out of the gate, you've heard me talk about this. You've heard me talk about mammograms. You've heard me talk about my own journey. But did you know that there has been a decline in mammograms? Did you know that? Do you know why there has been? Well, I'm not going to talk about it. Dr. Katharine Yao is going to talk about it, chair-elect of the National Accreditation Program for Breast Centers at the American College of Surgeons. Big conversation, big thing going on here, but this is an awareness month. Honestly, every month should be an awareness month. Dr. Yao, thank you for joining me here today. I was reading about this and I was like, wow, why? Why, right? Talk about what's happening.
So we know with the pandemic that breast centers shut down their screening mammogram programs. Anywhere from 50 to 80% of breast centers across the country shut down their screening mammogram programs for anywhere from 1 to 3 months. But we do know that approximately 6 months after that, most screening centers resume normal volumes. Now, when we say normal volumes, that means that they resumed the volume that they were doing prior to the pandemic. But it doesn't account for all the increased number of screenings that should be coming through.
Wow.
So we may have resumed normal baseline levels, but we haven't increased those levels. So there's still a lot of residual out there and a lot of people that still need screening mammograms that aren't getting them done.
So let's just give people a quick view on what mammogram screenings are. Now, for somebody like me, I'm aware of it. I've done many shows on cancer, breast cancer, the effects of it. I've lost people in my life. And so I have a level of awareness, but not everybody does. Can you bring people up to date on what it is and why it's important? Where are we today with the status of mammograms and what should people know?
So mammogram is like an X-ray of the breast. And we do in general recommend starting mammograms at age 40. You can start on an annual basis. And we know that mammograms save lives. There have been multiple studies, all the way dating back to the 1990s, that have repeatedly shown that mammograms save lives.
Yeah.
Mammograms also catch cancers at an earlier stage and a smaller size. So even if you do get diagnosed with a breast cancer, the treatments are less aggressive and your survival is better because the cancer is caught early.
Yeah. We can't say this enough. Or let me just, I don't want to speak for you. I can't say this enough. I mean, just got mine done, right? And people want to ask the question, why? I'm so busy, I don't have time. To be honest with you, this is something that I know people don't want to do because they're afraid of what they may get as a result. But I will tell people here now, we can help you through your fear. You certainly, doctor, can help people through the knowledge, information, and through the fear. And I think we need to tell people that we can catch this early, right?
Almost definitely. And I know that people don't like mammograms because they're not so comfortable. There's compression involved, but it's very short. I mean, it's a 5 to 7 minute test.
Yeah, really, it is.
And I will say that the machines have really gotten better through the years. The paddles are softer, the rooms are heated. And the technicians who perform the mammogram, the way that they position patients, it's just gotten so much better through the years. So
Yeah.
it may not be the most comfortable experience, but it's a short, uncomfortable experience for a great benefit that will last for years.
I want
So
to
it's
just make
important
a
to get it
comment
done.
on what you said, because one of the things I've noticed is the technicians have gotten not just better at what they do. First of all, they're extremely knowledgeable. The second thing is they are compassionate. You know, at least where I am, they are. They understand what you're going through. They understand how it works. And people say to me, well, I don't want to have a man do it. Well, okay, I've never had a man do mine. I don't even understand how they even figured that out. But there are so many things that we can learn from this. The other thing that's changed is, okay, I'm going to date myself. Once upon a time, right, you used to have to wait like a week, but now you don't. And then there are also possibilities where you can schedule your mammogram and your doctor together. So there are just a lot of options right now, aren't there?
A lot of options. And actually where I'm at, they have a screening mammography facility in the Nordstroms shopping.
Wow.
So you can go and get your screening mammogram and then go do some shopping. So so they're all over the place, and it really has become a much different experience. I have a number of patients that every year they schedule their mammogram with their friend or with their mom, and they make it sort of a lunch date. They go get their mammogram done, and then they go shopping, eat lunch. And it's a more of an enjoyable experience as opposed to like a medical appointment.
Now, I want to make sure people know how they can find out about the facts about what we're talking about. Can you tell us where people are going now to really get information?
For a screening mammogram, American Cancer Society they have a great website. I mean, I'm always visiting their website. Lots of information, lots of data if you want to read through that, but very good patient-friendly information. And that's where I would start if you wanted to learn more about screening mammogram.
And then isn't there a website, what is it, facs.org? Is that
that's the American College of Surgeons website, and they have a lot of very, very good information too about screening mammograms.
What I love about this is the amount of information that is now available is so much better than where we were before. You know, this has been a conversation that mostly affects women, but what is the message for men in this conversation?
So I think there's a misperception out there that men can't get breast cancer, but they can. So it's important for men to be cognizant of that. If they have a breast finding, such as a mass or discharge, they need to go to their doctor and get it looked into because it could be a breast cancer. Routine screening is not recommended for average risk men, but again, if there's a finding, then they should get it looked into.
This is an area you're passionate about. You're an expert in this, you know, every day you're waking up. This is what you're aware of. This is what you do. But I want to ask you this question. How far have we progressed in 5 years? And what are you excited about as you look ahead?
I think that the treatments for breast cancer have really progressed. And what's interesting is during the pandemic, there was sort of a halt or kind of a hold on research. And literally within the past year, there was publication of at least 3 or 4 major studies of new and different treatments for all different types of breast cancer that have really changed the survival rates. And they all came out at once. And I think part of it was because the pandemic sort of put a hold on everything. And then once the pandemic kind of died down, then the research continued. And it just shows that there's just so much going on and so many trials. And it's really good news for patients because it's not just addressing one type of breast cancer, it's all the different types of breast cancer and really promising treatments.
Yeah. You know, I will tell you that I'm one of your statistics because I realized during the pandemic, I wasn't paying attention to this. And then when I realized it, you know, I realized the level of fear I had around going. You know, and what I want to say to people is, even though it may be a long time since you've gone or you've had one, you need to push past the fear and get it done. You know, because I realized like how it was in the back of my mind, like all the time. And then, you go to get it done and then right? What can we say to the people listening today that we can help encourage them? Your top 3 reasons. This is why you should go get this.
So I would say you should get it because of the benefits of it. It saves lives. It catches things earlier. And because it's not going to be as bad as you think it's going to be. It's a quick test. You're going to be in and out of there in 10 to 15 minutes. And the benefits are just so great.
Yeah.
And I know it's something that people dread, but don't make it something to dread. Take a friend, go with your sister, go with your mom, make it a lunch date, make it fun, and don't make it something to dread, because it shouldn't be.
Yeah, I did mine so that I could go play ping pong right after. I mean, you're absolutely right about that reward aspect of that. I didn't really think that. I'm just thinking now that I did that really subconsciously, because that's my happy place. But definitely what you're saying is 5 to 7 minutes. What I'm finding is they take you really quickly. There are no long waits anymore. Everybody is really aware and protective. You may still have to wear a mask, no big deal. And you're right, it is over. And all the things you talked about improved equipment, more awareness, compassion of the technician, all of those things I have learned now through my own experience. We have changed to really be mindful of the patient. Isn't that breakthrough?
Oh, yes. It's a focusing on the patient, the journey, the experience that they're going through.
Yeah.
That has dramatically changed through the years. I've seen that for sure.
Yeah. I thank you for today, but I do have one other question. I would love to know your personal message. What do you want to say to the women that may listen to this, that are watching this? What would you like to say to them so that we can help people take that next step?
So I would say, don't be afraid of the mammogram. Don't panic that you're not maybe getting it done next week. Get it done in a couple weeks. That's fine. It's not going to be as bad as you think. And check your schedules. I can't tell you how many people have told me, oh, I'm up to date on my mammograms. And then we look back and it's been 3 years since they've had it. I mean, the COVID pandemic was a time warp for everybody, and people just lost a year or two. So check your schedules, check your medical record, make sure you're up to date. And don't be afraid. You're going to do fine.
Oh, boy, you just called me out, because that was me. When they asked me, when was your last mammogram? I said, oh, 2 years ago. They're like, no, it was not. But even though I showed up and I did it, thank you so much, doctor, for everything you're doing. I know you're doing interview after interview. I personally want to tell you how important this is, that you're out there talking with us. Too many people I've seen in my life not do what we're talking about today, and they're no longer here. And I don't want that for our listeners. Thank you so much for everything you're doing.
Thank you for the opportunity to talk with you.
Yeah.
Appreciate it.
So everybody get up to date on your mammogram screening. If you live in my state, so easy to do, so many places, so many things that if you're thinking, oh, on my insurance, this or that, please check it out. You're going to find that it's much easier than you think. Let's take a short break, everybody. We'll be right back. Hi, everyone. I'm Dr. Pat. I'm the host of the Dr. Pat Show, and I am the creator of the Transformation Network, doing what we do in the world of positive radio, informed, educated, positive media. Independent radio hosts and independent networks have been the face of positive messaging over the past decade. So all of us here have decided we're going to put together an independent network that is going to enable people to bring their positive message of hope, inspiration, and conscious action to the forefront. Help us create a future of amazing, uplifting stories that can be told, so we can tell our children and they can tell their children of what hope and conscious action is all about. I want to thank you all for tuning us in, turning us on transformationtalkradio.com. Hey, everybody, welcome. I was wondering who was going to take this fight on. I was thinking to myself, is there somebody out there that sees what I've seen? Is there somebody out there that looks at marginalized communities and have seen the pain of what it's like to fight obesity? But how about fighting obesity among Black women? Now, you have heard me tell the story of my sister, 450 pounds, dying on a hospital floor. And you've heard me talk about my relatives, people of color, as we are. But what is anybody to do about it? Does anyone care? Yeah, Khaliah Ali, joining me here today, cares. And you know, when you care, you take action. That is what this amazing woman is doing. Healthcare advocate, activist, designer, author, daughter of former professional boxer, Muhammad Ali. Now, I want to say this. This is not a conversation that doesn't require action. This requires action. And why? Wait till you hear the conversation we are getting ready to have. And I want to ask all of y'all out there, what are you willing to do? What is your commitment? How are you going to pass this on to others? How can you help? Wow. Khaliah, thank you for joining me here today. It's great to have you on the show.
Dr. Pat, I am touched, honored, and pleased. Truly, the pleasure is all mine.
Now, this is a conversation that my family, my sister, my sister's children, you know, we come from a very diverse family. Believe it or not, I may sit here and by the way, you know, the color of my hair, I just did it. But what I'm trying to say is we are not talking about this. And I want to ask you, what touched your heart for you to then say, here I am, Khaliah Ali, here I am, and I am going to do something about it. What struck you in this?
Let's start with the numbers. 4 out of 5 Black American women are overweight or obese. 76% of all Black adults are either overweight or obese. This epidemic in our country is just one that we can no longer afford to turn a shoulder to, especially within the Black community. And like so many, I personally have struggled since childhood, personally and publicly. I made my first appearance on the Today Show at the age of 9, and and actually consequently visited again when I elected to have my bariatric weight loss surgery live on Today Show. So for me, you know, one of my favorite poems of my father is Me, We. You know, we're also profoundly connected, and we need each other, and we need community, and voices need to be heard to make change. And like you, sadly, I have lost along the way people who I love dearly. About a year and a half ago, I lost my brother, my friend, somewhere between COVID and cardiac comorbidities due to obesity, and making the struggle so vividly and painfully clear to me. And of course, within our community, while certainly COVID impacted everyone across this world, it disproportionately affected the Black community, notably too, as well as those who are overweight. And so, you know, I've been so gifted with the platform I have as my father's child, always taught you build a longer table, not a higher wall, and give. And it's a powerful way to curate his legacy as well, but mine too, you know, and to let people know, though we have many different voices, you know, and I sat down at the round table and I spoke to 4 incredibly powerful and amazing women. And I encourage you to please listen to our conversation. You're going to identify and find yourself. You know, there's just a common thread that runs through all of us. You know, though we may have different struggles, different backgrounds, there's certain basic things that we all fight with, and we need to stand up and fight for together.
Yeah. Look, I want to say this. I am beyond thrilled that you're taking the conversation out. And let me just do this. For people that are listening, I want to acknowledge your courage, because despite what you may think about people that are well known, that are celebrities, that are out there in the world, coming on public television and doing what you did is an act of courage. But it is in the spirit. And of course it has to be. It is in the spirit of your dad. I mean, I remember a quote, and I'm telling you, I go way back. And so I understand and followed his energy, and as a matter of fact, his inspiration for so many of us that didn't feel like we could rise up. And I come from the projects in New York. And so when he said only a man, and I said man and woman, only a man and woman who knows what it's like to be defeated could reach down to the bottom of his soul and come up with the extra ounce of power it takes to win. Now, that to me has been a mantra. That's what you are helping people with, isn't it?
Yeah, it's like sometimes I'm winning, sometimes I'm losing, but I'm always committed to the fight. It's a bariatric patient. I'm a revisional patient, and there's no doctor that's ever going to operate a poor diet or my lack of inactivity, So to be very transparent, the struggle's real. This is a marathon, not a sprint. I'm talking to you this morning at my lowest adult weight ever, but let me tell you, this is going to be a struggle to keep it here. Obesity is an awful disease. It's an awful disease, but you know what's great? What's great is the fact that folks like Endoethicon and the American Academy of Family Physicians are getting behind us. They're recognizing us. They're reaching back into the community, and they're giving us the tools to start the conversations we need to lead to success. I feel like they're giving us the gloves to put on. Now we have to get in the ring and fight. And again, you can learn so much more and hear this conversation at familydoctor.org/healthy-weight or #fight2flourish on social media platforms.
Yeah. And by the way, I want to make sure you all do that. Go to the website. There's lots of information. I've already been there. Can I ask you this question? And thank you for coming on here and sharing this information. But, you're somebody, I'm somebody, look, we've battled this. I know what you're talking about. I believe me, I know every aspect of this. I watch my sister go up and down and sideways myself as well. But here's the question I want to ask you about is, what do you see as the personal challenges in the Black community to rise up and really put the gloves on and knock this thing out?
So when we're talking cultural, it might just be as simple as switching recipes and not being determined to identify ourselves so closely with what we eat that's unhealthy for us. But on a more serious note, looking at very real issues and challenges, and again, you'll hear some of these conversations at the roundtable that we have to deal with within our communities, just living in food deserts and having access to affordable, good quality food, or, it's the socioeconomics of it and dealing with, again, similar to my family, where you have systemic obesity issues throughout generations for a multitude of reasons. But when we're talking about socioeconomics, the playing field clearly is not even. So we have to strategize, we have to learn, we have to be self-motivated to the best of our abilities, because life is hard. We work hard, the day is long, and I appreciate that. But to just start making it tangible and taking the first step in your personal journey into loving yourself and getting back to health. And the first step is always the hardest, isn't it?
The first step is the hardest, but you see, you're taking that first step and helping a lot of people out. What I love about this is, sometimes we look at the road and we don't see a pathway. We look at the road, we see a road, but we don't see this pathway, the pathway that's going to help us to get, physical, mental health, to get the challenges behind us. We don't see a pathway. But what you've done is you have taken the first step. So now we can see the pathway. Now we can take out, we can follow. And this is really such an important message. My first study, I can't remember when it was, probably after I lost my job and I went back to school, I studied the impact of socioeconomical, let me just say, consequences on people in different lifestyles, because I watched my sister. We all grew up, in the Bronx, right? This is us. We understand what this like. And yet I somehow got to be here. But it was so important for me to understand. And I want to ask you this question. Is it really time for an effort where we say we need some support to address this? Yes, we'll take the first step, but can you take the second?
Right. And the second really is speaking to your healthcare professional, because healthcare is so incredibly personalized and individualized.
Yeah.
And reaching out to your medical team to know what the right first step is, and utilizing Fight to Flourish campaign as a source of inspiration and connecting deeper within.
Yeah. I want to ask you this question because I love things like this. I want you to look a year out from now, and I want you to give us insight based on the work that you're doing, based on the work that people will find when they go to the website. I'm going to say it again, familydoctor.org. Based on all of this that's happening, take me out a year. And as you look ahead and you look at what you've done, please tell me your vision for what you're most excited about. What have you seen the change be?
So I want to see the family continue to grow. I applaud Ethicon and the American Academy of Physicians for bringing us all together, and just, you know, continuing the dialogue and taking one step at a time. You know, this is, like I said again, this is a marathon, a distance, and I just look forward to being connected deeply, to getting on the road and meeting people face to face and hearing the stories and hearing about individual successes. Yeah. You know, at hashtag Fight to Flourish, you have the opportunity to join us and lend your voice. And I'm just super excited about participating. And of course, with myself personally, every day is a struggle, you know, but it's also a victory when I stay connected and connected to source.
Look, I have one last area I want to really work with you on, and I've watched this over time. And, you know, one of the things you talk about is an individual approach. And we don't talk about this enough. There's so much we hear about groups and teams and organizations, you know, right? But there is an aspect of an individualized approach, which we don't talk about enough. What do you think are, from your perspective, what can we learn about the major benefits from this, and how might people take action today?
So I think you have to turn to your healthcare professionals and your healthcare team and sit down with your doctor and get the journey started.
When we look at this last part, and I want to talk about it because it's so cool. I love the phrase, fight to flourish. That came from the heart. What does that mean to you? And what advice do you want to give women to step into the ring on that?
Specifically Black women, to identify with feeling beautiful and feeling good and knowing it's just not enough to be healthy or at a healthy weight. You want to flourish. A lot of when we're struggling with obesity includes, you know, kind of not really feeling like our outside matches our inside. And, you know, it's going to take a team. It's going to take a village. We're here for you. So Fight to Flourish also means that there's a community waiting for you, to embrace you, to hear you, and for you to be heard. And that, you know, it's a positive connotation, meaning fight to flourish. We will fight and we will flourish. You know, this can have a happy ending as an individual for what's right for you, as it has for me. I mean, I can't tell you, I've never felt healthier and happier in my whole life.
Wow. Last question. What's your personal message? What do you want to leave us with today? And thank you so much for taking the time to get out there and do this.
Oh, pleasure's mine. Thank you for having me. Really just please go within, hear your own thoughts, and be brave. This isn't easy. And take the first step. That's the hardest. And please reach out to your medical professionals and figure out what's right for you. And thank you so much for having me today. Just remember, hashtag Fight to Flourish. Please join us.
Everybody, let's join the fight. This is something that if you're not aware of it, please get aware of it. If you don't understand the struggle, please take the journey with someone else. If you don't know how to help, you just heard how today. Let's take a short break, everyone. We'll be right back.
TransformationTalkRadio.com. Let the journey begin.
Hey, everybody, welcome. Look, those of us that are out in the world, we know what happens when you say the words prostate. Many of us have had dads, we've had partners, we've had friends And there's one thing we know, and boy, I don't like to generalize, but the hardest conversations I've ever had with my family and loved ones is when I've had to talk to another male member of the family to go get something checked. Today, I am so thrilled to have us join the show today. Somebody that knows a lot about this, somebody that is passionate, somebody that does it on a regular basis. Dr. Mehan joining me here today. And what is this that I want to say about who he is? What he is about is the passion and purpose of getting a message out there, conversations that are very difficult to have. And I'm going to tell you, whether it's a man-to-man conversation or woman-to-man conversation or doctor-to-man conversation or doctor-to-anybody conversation, we want to give you some insight today to say it doesn't have to be hard. It can be a level of awareness. It could be something that gives people hope. Dr. Mehan, thank you for joining me here today. It's great to have you on the show.
Well, thank you so much for getting me here. This is amazing.
Am I right? Okay. Am I projecting or am I right? Look, I have been doing interviews for a long time. I have helped a lot of people with understanding more about their health. The hardest conversations I've ever had have been with either male people in my family about this topic or friends about this topic. And honestly, I can't even get 2 sentences out because there's never been enlightened hope about what they can expect. Now there is. Can you enlighten me? Because you know what I'm talking about, right? I don't know if it's because I'm a woman talking to a man, but whatever it is, when you open this conversation, you have to say, we have good news for you.
Yeah, this is a conversation that needs to happen. This is listen, we need to demystify men's health, prostate health, and talk about this as much as we can. Did you know 50% of men by the age of 60 suffer from symptoms of an enlarged prostate? It is everywhere. If it doesn't affect you, it will. And it'll affect somebody that you love. I mean, this is our brothers, our fathers, our friends. And we have new technology. It's been a renaissance of new technology in what I do to really make the process so much easier.
Yeah.
So we can help men. It's so needed.
Look, I want to cut to the chase because I know these are small, short interviews. I was very excited. I know what you do is really outstanding. It is forward looking. I love the idea things are forward looking, but let's talk about what the discovery is. What are we talking about when we talk about water vapor therapy, and why is this now a very cool conversation to have, despite how scary this might be, right?
Yeah. I mean, so for years, the US BPH market, the market for enlarged prostates, most men do nothing. They just watch it. Some men are started on medications, and then we've had surgical treatment options. And that's kind of how we roll for years. But the renaissance started, 7 years ago, 2015, when Zoom came out. And now we have in-office treatments where a guy can come in one office visit, his prostate can be treated and he can have long-lasting results and preserve sexual side effects. I mean, all these treatment options work. They all have pros and cons, but we have a new class of treatment options that are done in the office that work extremely well.
Oh my gosh. Everybody, Dr. Rahul, I'm probably killing his name. Dr. Rahul Mehan joining me here today. And I want to say, for those of you, East Valley Urology Center of Arizona, Doctor, listen, I love that we're sharing this message. And what I love about it is that we're talking about a treatment. The other thing I love is thank you for really activating what many of us know. 5 years ago, we would not be having this conversation. This conversation for many doctors was scary as hell, just to be honest with you. Now, what is your takeaway when we think about Resume? What is your takeaway that you want to say to the people listening? And by the way, not just men, because the conversation here today has to go to the women, because they're the ones that are going to bring the message, right? You know that, right?
Yeah, I can tell you probably a majority of the office visits are set up by their significant others, because they're waking up at night too with the guy, when they're going to have to use the bathroom, they're there. When they're going to Home Depot and Lowe's, they're being drugged to the bathroom too, because, it affects everything. Yeah. And, it's such a common condition. But it's women who get things done in our society. And, this message is for everybody.
Look, let's have a conversation. I want to go through here really quickly. For people that don't understand what to look for, let's start with some of the signs that we should look for. And then we're going to talk to how cool this therapy is. Because when I saw this, I have to tell you, when I started to read about it, I thought, oh my gosh, this is like those suits in the new movie Dune that really extracts the water for good use. I'm sorry for that analogy. But let's talk about symptoms for a minute for people to say, look, if this is happening to your loved one or you, hit the pay attention button.
Okay. So the most common symptoms that I see are men start noticing that they're waking up several times at night to urinate. They may have a weak or interrupted urine stream. They have a hard time starting and stopping their flow. They have a feeling or a sudden urge to urinate at times. They may not be sure that they're emptying their bladder completely. They may dribble urine at the end of their stream. They could have painful or burning urination and have an inability to go when they feel like they need to go. They just lose that control that they've had before. And this is a subtle change. Yeah. Men start noticing this in their 50s and they're like, yeah, something's different. Yeah. And that can progress and become extremely severe over time.
Yeah. You know what? Let's make a statement. I want to say this for all the men out there, you know, my family members including. Here's the thing. I don't care what you think, you know, that this is normal part of the aging process. When you think in your mind, oh, I'm just getting older, like stop and think again, because that may or may not be true, but there's no harm really with hitting the pause button and paying attention, right? Right, doctor?
100% agree with you. Yeah.
Okay. I started to look, I resume. And first of all, let's give out the website. I want to give out the website like 100 times, but let's show people how they can find out more right away. What's the best place for people to go?
Resume.com. It's easy. REZUM.com. And the website is fantastic. It has information about the procedure and a link to find a doctor, a quiz that you can take to see how bad your symptoms really are and give you a number. And that should be your call to action, you know, log on today.
And you know what I love? Here's the call to action. This is how we open the conversation. Those of us women that are really getting ready to have this conversation for the 999th time. We get to say, hey, there's something new out there. It's a natural alternative to surgery. It treats the cause of your BPH, which we're going to talk about, so you can get back to your life. So if you can start a conversation like that, then they might say, oh, what is it? So let's tell them what it is.
Yeah. So Resume is a minimally invasive in-office procedure to treat an enlarged prostate, not just the symptoms. It uses water vapor to reduce the size of the prostate and provide lasting symptom relief while preserving sexual function. It works by using the energy stored in water vapor or steam to remove excess prostate tissue. And after the treatment, the body's natural healing response is unleashed and it absorbs all the treated tissue, shrinking the prostate. And when that extra tissue is removed, the urethra opens up, reducing symptoms of an enlarged prostate.
I got to ask you this question. First of all, I can't thank you enough for really taking this message out there, but I want to know what's in your heart, because I've been doing interviews for 20 years and I always know there's something in somebody's heart. I always know there's some kind of inspiration and motivation that takes a person to the next level for a cause. What got in your heart about this?
Yeah. As a kid, I saw my grandpa suffering from an enlarged prostate and not being able to do the things that he loved to do. And, that was kind of my motivation to go into urology. And then my dad had trouble urinating and had all those symptoms. And I was in my training to be a urologist and I got him help and it changed his life. And it's been, oh man, that's like over a decade ago. He's still doing great. And that's my motivation. It's just seeing it, it hits home to me too. And to all of us. I mean, this is a condition that's going to affect somebody in our lives and they can be helped, most definitely.
I agree with you. That's why I had to ask you that question, because once we see this with our loved ones, we can't sit idly by. And for what you've done, it's been amazing. I know I've got a few minutes left, maybe less than a minute. Here's my question. I want to know, again, mention the website, but what's your personal message? And if there was one message you wanted to give people, what would that be?
Yeah. Only 2% of guys with severe symptoms get treated in the United States. That's a disgrace. We need to do better than that. We need to take the ones that we love and help them. And we have the technology. We have all these wonderful and beautiful things of modern medicine. Let's use them. Let's have this conversation. I would like, I'm working in collaboration with Boston Scientific. Check out their website, resume.com, find a physician and get the help that's needed.
And I want to end up with this for those of you out there, if you're wondering about the results, here's the thing. For the patients who receive resume therapy can typically resume normal activities. Listen to this, within a few days after treatment, and most patients see symptoms improve within 2 weeks. You see that? That right there is a game changer. Doctor, thank you so much for today. Thank you for all that you're doing.
Oh, it's been a pleasure to be here. Thank you.
You bet. REZUM.com. Check it out. Pay it forward. Let's take a short break. We'll be right back.
TransformationTalkRadio.com.
Hey, everybody, welcome. As you well know, or maybe you don't know, this is the time, October, Breast Cancer Awareness Month, that we really take the conversation to a whole new level. And that's what we're doing here today. Dr. Pamela Habib joining us here today, head of U.S. Medical Affairs, Bayer Radiology, and Dr. David Schacht, breast radiologist at Northwestern. Every time I read something about Northwestern, I'm just like blown away about what you all are doing. You happen to be, these interviews are one of the premier ways that information gets out. And I will say that you are leading the field. Here's what I want to say. Thank you for joining me here today. Many of us have lost parents, friends, countless people. And I think it's because, one, we are afraid, and two, we're just not aware. I want to thank you because the thing we're talking about now, I think, is the most, or rather say the most misunderstood and least known about. Let's talk about breast density, and let's talk about why each of you are here. Let me start, first of all, with you, Pamela, Dr. Pamela, if I could, and then we're going to hop over to you, David, okay?
Sounds great.
Why do you think this is? That statement I made, why do you think we are here and on a mission to not just make this awareness, but this is an awareness in action call, isn't it, Dr. Pamela?
That's exactly right. As you mentioned, I mean, almost everyone has been affected by this disease in some way and continues to be. And although treatments are improving, there's so much opportunity to detect cancers earlier and get the word out there that screening is important. So we try to use this month and this time to really to encourage people to get screening that they need, but really all year round. And one of the topics that we want to focus on today is breast density. So on top of just the regular screening, the fact that there might be additional screening that could be required in a woman with dense breasts is something that we'd like to discuss here today as well.
Yeah, I want to just comment. I'm going to make a statement. You all tell me if this is true or not. I don't mind being the guinea pig out here. One of the greatest misconceptions is that basically, if you're a thin person, this is for you to worry about. But you know what? If you have a few extra pounds, you don't have to think about density. How true is that, Dr. David?
Yeah, I'll take the untrue side of the column there. But to your point, I think it's a relatively common misconception that you can know your breast density based on either your body type, or if your breasts sort of feel dense or lumpy, bumpy when you feel them, or when a doctor does physical examination. What we're really talking about when we're talking about breast density is how they look on the mammogram. And really, until we see the mammogram to really define the amount of what we call dense fibroglandular tissue, really we can't make that determination. So, I know that was a bit of a setup on your part, but to your point, a patient's body size or body type, or even the way her breasts feel on physical exam, aren't really the definition of what we're talking about.
And, the only reason I brought it up is I've had my friends say that to me.
It's quite a common thing. Yep.
Yeah. And that's why we're here today. Look, let's talk about this. Let's go back to you, Dr. Pamela. what is breast density for everybody here today? I want folks to know, what are we talking about here? So we eliminate any of the confusion. And then let's talk about, what do you do, mammograms, and why you two are here for this call of action. Pamela, let's start with you, or Dr. Pamela.
Yeah, sure. So breast density, as Dr. Schacht had mentioned, is really something that we identify on the mammogram. And every mammogram report in the US will have a comment on how dense the breast is. What that means is how much dense tissue there is compared to fatty tissue. So those are the two types of tissue that we can see on the mammogram. And the reason why it's important is because the more dense tissue there is, the more difficult it is to read that mammogram, because tumors appear white on a mammogram, and so does dense tissue. So you can imagine, if there's a lot of dense tissue in a woman's breast, it could be very difficult to find a tiny white tumor hidden in there. So that's one of the reasons why it's important. Another reason is that having dense breast actually increases the risk of a woman to develop breast cancer. So a woman with the most dense breasts is 4 to 6 times more likely to develop breast cancer than women in the least dense category. So that's why we want people to be aware. It's a normal finding and very common. Nearly half of women age 40 and over who have a mammogram will find out that they have dense breasts. So it's not something that someone needs to immediately be alarmed when they see the report or when they find this out. But there can be additional tests that can help you, which is why we want to make sure that these women have conversations with their healthcare providers.
Yeah, Dr. Pamela Habib, look, I want to stop for a minute because I have looked at your website. And I want to make sure everybody on here, hello, you need to go to this website, because this is, first of all, educational, informative, the way you've laid it out. I love the way you're educating people. So let's make sure we mention where people should go. Let's do that right now, Dr. Habib, if we could.
Yes, sure. Thank you for that. The website does have a lot of great resources, and it is densebreastresources.com. It has information on breast density, tips for talking with your healthcare provider, how breast density can affect your screening needs. So it's a really great place to start to gather more information.
Oh my gosh. Dr. Schacht, look, you are in it every day. Well, both of you are, but you're in it every day. You see this every day. You understand what people know and what they don't know. What do we do from here? There are things that I didn't know that you're talking about here. For example, what do you do if you have dense breast? What do you do? Do you do something different? Do you ask different questions? Okay, I'm laying that all on you, Dr. Schacht, for the moment.
Yeah, I mean, I think we're living in an era of more and more personalized medicine. And I think this kind of falls into exactly that category where we know that these decisions are not necessarily black and white. There's not a one size fits all solution for every person. And that's actually great, and means that really the discussions with your doctors about your values, the discussions about the different trade-offs for the different tests, those are important conversations for folks to have with their doctors so that they're getting the care that makes the most sense for them. And so that we're, our job is to educate our patients, help them understand what the tests can do, understand what the density means, so that they're empowered with the information that allows them to make the best medical decision for them.
I was reading some information. I'd like both of you to comment on these two statistics because I want everybody to know. Mammograms miss up to 40% of cancers in women with dense breasts because dense breast tissue can hide or mask potential tumors. Dr. Habib, you touched upon that. The other statistics I want to put out there is that, and these are big numbers for people that are not statisticians. I want to tell you, I am one, and I'll tell you these are big numbers. 30% of women do not feel informed about how their breast density impacts their breast cancer risk and screening needs. Now, in the world of statistics, that is so far beyond the margin of error that I don't even know what to say. But that's why you both are here. Dr. Habib, that's why you're here, because you're here because we need to make those numbers smaller.
Exactly. That 30%, it just shows that there's so many women that would value additional education and could benefit from additional education, which is why we want to, which is why we're here today, and we're trying to get the word out continuously.
Yeah. Dr. Schacht, I want to ask you a question. You're sitting in front of a woman right now, and you're getting ready to have a conversation, and you're thinking about all these interviews you both are doing. And you've learned so much. It's all over your website. Give me the top thing you want to say to that person to make them more aware.
Yeah, that's what we do every day, is help folks understand exactly some of the data that we've talked about today. And, I always want women to understand that across all types of breast density, mammograms are step one. They've been proven to reduce breast cancer mortality across all breast densities. So, I think there's sometimes a feeling of, well, why don't I just skip the mammograms and do something else? And I think that's one thing that I always try to emphasize with my patients, is that mammograms are step one. There are lots of different ways that breast cancer can present, and multiple of those findings, as we call them, can still be seen in women with dense breasts. So after we've accomplished step one, that's really where we start to get into some of the decisions about these extra screening tests, such as MRI or ultrasound, that really can be made in a shared decision-making model with our patients.
I love it. Dr. Habib, I want to ask you this, because you know this, right? I have sat across the table, and clearly, I don't really know how to say this except as a woman. One, this is one of the things we put on the bottom of our list. Two, when we do go to get this done, we don't really know what to ask. If you are that woman and Dr. Schacht is talking to you, what are your top 3 questions would you like to ask him? As the patient, you're asking Dr. Schacht as the doctor. What would you like to ask him?
That's a great question. And I think some of the things that Dr. Schacht has mentioned about screening and why am I here and, what is the benefit, I think it's a great place to start. If your mammogram shows that you have dense breasts, or you just want to know, you didn't see it in your letter and you want to find out, you can ask. And I would ask, how dense are my breasts? What category of density am I in? And what does that actually mean for my personal breast cancer risk? And I think it's also very important to share any risk factors that you might have, so that your healthcare provider can take that information, understand your personal history or family history, and look at your mammogram and put that all together to identify whether you might benefit from supplemental screening in addition to that mammogram.
I love it. I want to make sure, Dr. Schacht, back to you. I want to make sure people have this website. I mean, good job. I don't know how involved you all were in this, but everything from the pamphlet that you have about understanding your density, everything in the website is, first of all, very easy, accessible, easy to read. And you've created a forum, shall I say, let me call it that, a forum. And thank you for putting people's stories in here. Let's give out that website again, Dr. Schacht, if you could.
Sure, absolutely. So the website for more information on breast density and for some pointers on talking to your healthcare providers about density is the website densebreastresources.com.
Okay. I know these are short interviews. I want to tell everybody, even if you are not the person we're talking to, I want you to take this website and I want you to pass it on. I want you to text it to the people that you know. I want you to make sure that people in your life know about this and know the questions. Last question for each of you. I know you're here because there's something in your heart. I know that. We're all here because of that. You wouldn't be doing back-to-back interviews, getting asked the same questions if you weren't. I want to know, starting with you, Dr. Habib, thank you for joining us here today. What is in your heart and what's your personal message? And then Dr. Schacht, for you.
Thank you for having us to help us spread this message. For me, it's just not being scared to speak up. If you have a concern, make sure you talk to your healthcare provider about it and don't ignore the annual test. I think it's easy, as you mentioned, it's easy to ignore, to not show up, to delay it. But really, if you are at that age and you're ready, you're at the date to have your annual screening, I strongly, strongly recommend that you do that on time.
Thank you. Dr. Schacht, how about you?
Yeah, breast cancer is unfortunately a common disease, and we have great tests and great treatment so that the outcomes are so much better now than they were a generation ago. And I think that's something that I'm very proud of.
I want to thank you both. I can't say enough about how important this is. You know, certainly when I think about my mom and I think about the people that have passed and I think about what if they'd had this information, you know, the what ifs in our lives are what save lives. And thank you both for doing what you do. And thank your organizations for us here at the Transformation Network, because you all keep showing up. Thank you so much.
Thank you.
The views expressed